Welcome to Healing Our Planet by Radically Listening to Communities. There will be a Q&A session at the end. If you would like to submit a question for the panelists, please do so in the Q&A panel. You will have the opportunity to upvote any questions that you would like to hear answered by clicking on the question. This session is being recorded. Thank you.
Welcome everyone from wherever you may be patching in here to our virtual session. We're just thrilled to have you attending and so honored to have Dr. Kinari Webb with us to talk about the urgent crisis of our time, which is also an opportunity, which is how do we heal the planet, address human health, and also biodiversity, all the species health. And really learn more about the very interesting strategies and collaborations and partnerships that are making that possible through the organization that Dr. Webb founded, Health in Harmony. But let's just begin with the context setting. IPCC released this report just 2 weeks ago, its very latest report, clearly pointing out how urgent this crisis is. The opportunity by both mitigating our environmental footprint in the world as humans, as well as adapting to the impact of the climate crisis and other planetary health stresses, the opportunity for health benefits. And so this is really a very important time to talk about that. Last week's the IPCC report also made the point about the importance of the biodiversity, the health and environment connection, and that is precisely what Health in Harmony has done. So obviously we're really interested to hear about some of that. We all are living through this climate crisis. We recognize there is a deep injustice and equity question to it, because the most impact that's being experienced at the moment around the world are in communities that really did not contribute proportionally to the problem. We know that more and more people around the world are recognizing the need for all sectors, including their governments, to take action, including in the US. And we know that we really must address these issues, because with all the impacts that are coming with extreme weather, rising coastal levels, half the world lives in cities, the contribution of cities to health, food insecurity, and the connection between climate stresses and human strife and population displacement, that these are the issues we have to address, and remembering that health is really tied to the health of human health is tied to the health of ecosystems. So there's really this framing called planetary health that's been developed around how to think about this and put all those pieces together. And it is an area that Health in Harmony has also been working on in terms of curriculum and really exemplifying living that model. So when we think about this, and this is this idea of human health, environmental health, and ecosystem health, which is called a One Health framework also, really the roots of that and the approach to that has a very strong ties to indigenous wisdom in communities around the world. As we think about rainforests, particularly being the lungs of the earth, and the people who live in those spaces being the guardians of that, and the best people to promote that health. The world owes indigenous people, particularly in the forest, a great debt for the work that's being done and not always supported. So because planetary health is the driver of human health and also social integrity and equity, we know we need to have action. We need interconnected solutions, and these are things that Health in Harmony has been doing. So just to give you the quick rundown, we're going to have a bit of a conversation, Kinari and I, really informed by the work that she has done with partners around the world. And then we'll have time for Q&A, and we do have some great questions that have come in that we'll get to as well. We have 1 hour together, so let's get going. So really wonderful to have Dr. Kinari Webb here, coming home to Yale. She graduated from the Yale School of Medicine with honors in 2002. She founded Health in Harmony, and she co-founded ASRI, which is the NGO in Indonesia, with whom the partnership has been completely integrated over time. Health in Harmony is an international nonprofit dedicated to reversing global heating by protecting rainforests. In 2007, Dr. Webb pioneered an experiment in reversing deforestation that entailed listening to the experts on the ground, the people living in the rainforest communities, and in particular the communities encircling a Borneo rainforest, and then facilitating these solutions that they came up with and prioritized to integrate the care of humans with the environmental needs. This approach really succeeded incredibly in protecting the forest while also dramatically improving the community's well-being. And she'll be able to describe some of the statistics and the impact that was accomplished. So Health in Harmony is now replicating this partnership approach in Madagascar and Brazil and is working to scale up globally. Dr. Webb currently splits her time between Indonesia, international site assessments, and the San Francisco Bay Area. She's quite busy. She's also authored Guardians of the Trees, which is her debut book detailing the events that led up to the creation of Health in Harmony. So welcome, Kinari. So great to have you here.
Thank you, Anne, so much. It's such an honor to be here and lovely to get to talk to you because you are also such a pioneer in planetary health and really advocating for it in so many different ways. And I'm so grateful for that.
Well, I only because I believe that nurses and midwives as the foundation of every healthcare system have to be involved and are leading change and always have. So it's all about nurses and working in partnership with other clinicians and the communities. So Kinari, just to start out, you've had this incredible journey, and wow, what an opportunity for you to reflect on it and be able to put it into print. You've collaborated now in 3 countries and around the world, but it all began with that original trip and the experience of being in Indonesia, really to study the orangutans, right? That was the starting point, and in the course of that, you got to know the rainforest ecosystem and the human community that was so important in these lungs of the earth that are so threatened. Can you talk about, just kind of recapitulate those key steps in the journey, if you will, as you've outlined in the book?
So it was just such an amazing time to go study orangutans when I was still an undergraduate. It's a kind of off the edge of the earth in some ways, just that you can't really be anymore, right? A place where there was no connection, no phone. It took 3 months to get a letter, right, from where we were in the forest out, and then another 3 months to get a letter back, right? So it was very, very remote. And we spent every day, all day alone, like a 1-year silent retreat. It was pretty intense. And I fell in love with the forest and the orangutans, but you could hear the trees falling in the distance. And these are not small trees that are 22 stories tall. We don't know exactly how old they are, but they may be even up to 1,000 years old. These amazing, beautiful, magical places that were just disappearing around me. And I was so angry at the loggers. And I thought, what is wrong with these terrible people? How can they not understand how important this forest is for their well-being and for the planet's well-being and for the orangutans' well-being, right? But then I got to know a lot of those guys. And then I discovered that they were often logging to pay for healthcare. And that just like hit me so hard. And as I began to study all of this and realizing that the reason these communities had so few resources was because of hundreds of years of colonialism, right? Of stealing resources from them. And now they were in this horrible catch-22 where they had to make trade-offs between their short-term well-being and their long-term well-being. And that damaged the health of the whole planet. And I just felt like this just can't go on, right? We can't have a world where people have to make these decisions, because if we do, we won't make it. And so I decided to go to medical school, but really with this idea of combining human and environmental health. And then after residency, I went back and I traveled all over Indonesia first and saw this same problem everywhere. And now, as I've been exploring around the world, we see it really everywhere in the world too, where people have to make these horrible trade-offs, and they're very, very, very aware of it, right? Like even people bombing coral reefs, knowing fully that when they do that, they will have less fish in the future, right? But if you have to get enough money for healthcare right now, right, with a whole bunch of fish, you will do it. Same thing. You will cut down many, many, many trees, knowing that that is the watershed for your rice fields that feeds your family. And that it increases disease, and that, and for them as well, it's like sacred space. To lose that is also very important. So I love the way you said it, this idea of planetary health. It's kind of a new idea in academic world in the West, but this is a very, very, very old idea, and one that indigenous communities, they can't even see that you could think about it differently. Right? Of course, human health is related to the health of the environment. How could you possibly separate them? Right. And we think about it usually in one direction, like, oh, the forest is important for the health of humans, right? But we don't usually think the health of humans is important for the health of the forest, right? Like they go together in that direction as well. So then we listened around this national park where we went back. Ended up going back to the national park where I studied orangutans. We listened all the way around the park in every single community. I thought every community would come up with a different solution, but they all came up with the same solutions. They all said that the thank you that they needed from the world community so that they could thrive and the forest could thrive would be access to high quality, affordable healthcare and training in organic farming. Another like total surprise to me. But when we did those things, 10 years later, 90% drop in logging households, stabilization of the loss of the primary forest, and in fact, 52,000 acres of rainforest grew back, 67% drop in infant mortality, and across the board improvements in health. And the amount of carbon that these communities saved was worth $65 million. It's very, very, very impressive what these communities, that they understood exactly, I call it like the fulcrums of change, right? Like these key things that when I looked at the problems in those communities, oh, they were all over the place, huge problems, right? But they said, no, if these two things change, everything else is going to get better. And it's true. Everything else got better.
So that beautiful understanding of interconnectedness was just inherent there. Yeah. So
Yeah.
you were a little surprised by just seeing some of the thematic, the universal elements that people were coming up with as you did the listening sessions. Talk a little more about the radical listening approach and the tech, as it clearly is a technique and a tool that Health and Harmony is used, but it certainly draws from pre-existing, traditions and even, sort of scientific evidence base around it as a strategy. So say a little more about that as a tool.
Well, it mostly draws from indigenous practices of talking sessions and circles and listening, and it's a relatively, I would say, traditional way of doing it there, although usually the leader sits up front and sits higher than everyone else. And we put everyone in a circle, all at equal level. And then the listeners, usually an outsider, sometimes that was me, sometimes it's someone else, could be someone from Jakarta, right? So like someone who's the community sees it's someone not from there. And then someone who's very much from there. And listening together and just mostly being silent, just asking that kind of broad, open-ended question. What would you need to thrive? What would you need as a thank you from the world? And then the solutions just pour out. But what's so fascinating to me is that they end up it'll take them an hour and a half to come to like consensus or agreement. But then when you look at every community, they all come to the same conclusions. And that really tells me that this process is a process that really works. And we've found that it works all over the world. The solutions are different in every place, but they're different, like within an ecosystem, we find. That when people are experiencing similar kinds of problems and the ecosystem is the same, they end up identifying the same solutions, even if they've never thought of them themselves previously, right? But together they can come to the wisest and best solution.
So there's something about that group process that draws it out.
Yeah.
Yeah, you describe it as something done at the beginning of working with communities, but talk about the pull through over time and how do you feed back? And
right.
in research we call this community-based participatory research, and you try to identify themes first, and then you try to build an intervention around that, and then you circle back and you say you check in and you check in with the members and say this is what happened. So that whole pull through, can you speak a little bit about that?
Yeah, so it's a constantly iterative process for us. First, like the first meetings really identify what the key like overarching solutions are. Like I said, high quality, affordable healthcare, and and that they often have, in those initial meetings, some details will come out. Like we really need access to an ambulance, we need mobile clinics, we need midwives. It's a very common issue, or nurses. And so but then the next meetings are like, okay, so now these overarching solutions, what are the exact details? In which communities are, if you need nurses or midwives, which villages are they going to be in? Which house are they going to be in? What exact services are they going to provide? How all the details get worked out by the community. Then we implement those. And then our experience is usually there are some things that happen where we're like, oops. Like for example, the organic farming training went amazingly. There was so much manure in the communities because also no one knew there was anything you could do with it. So there was no price for manure. But then suddenly everyone's using it, and then there's a price for manure, and then people are hoarding it, and then there's like no manure access. Right? So then we have to go back to the communities. Okay, what do we do now? Goats for Widows gets designed, right? Like this kind of iterative, making sure how things are going. In Madagascar, they've asked also for this kind of rice, a special kind of, it's called SRI rice production. So we've been doing that. That's been working really well. It's been working amazingly, but then we have 4 cyclones hit within a month. This is like climate change. It's a total, it's terrifying, right? So now it's like, go back to communities. Okay, how do we rebuild and fix after this, and how do we get back to out of food scarcity, right? So these are, it's a constantly iterative practice.
Yeah, as also the stresses change and the outcomes change. Speak a little bit more about the Goats for Widows, the chainsaw buyback. There's been some interesting, so almost economic tools in a way. The payment with seedlings instead of cash. Talk a little bit about those elements as well.
Yeah. So one of the things when you talk about affordable healthcare, right? So one of the reasons we didn't make healthcare fully free, and this was designed by the communities in Indonesia as well, in Madagascar, because they said, well, free things are not necessarily valued. However, you want to make sure that everyone can access care. So the way that we do that, and the way that's been designed by the communities, is you can pay with all kinds of non-cash payment systems. So for one of those is seedlings, you can pay with handicrafts, you can pay with labor. And then also we offer discounts to communities that protect the forest. So sort of in relation to how much they're protecting the forest, they get a greater thank you from the world community. So they have to pay with fewer seedlings, for example. And that is also, that's a little trick that we use, because it's much easier, unfortunately, in the world of philanthropy to get money for conservation than it is for healthcare. So we can get the conservation organizations to pay for the healthcare discount. So that's another little, it's useful.
You've been using behavioral economics on the funders, actually.
That's correct. You got it.
I like that. Yeah, but it is, it's really, you have to use all the tools that get you where you need to go, right?
Yep.
Yeah.
And then you asked about the chainsaw buyback program. After 10 years, we'd had that 90% drop in logging households. But the remaining, so almost all of those loggers had switched to organic farming. And in one community, I talked to one of the guys who was just so excited because he had made $80 the month before on his organic, right? Like, now that's a lot of money when the average income had been like $1 or $2 a month, right? Sorry, a day. So, a day, but still, that's like many times what they were used to making, right? And so he told me as well that about 80% of the people in that community had now switched to organic farming. However, after we looked at those like remaining 10% of people. Why were they still logging? This was it turned out a little bit of a different group. Mostly they didn't own land. That was very unusual there, but they didn't. And they usually owned their own chainsaws. also a little unusual because usually they kind of work in teams with one chainsaw, right? So these guys owned the chainsaw. So they had like more of an investment in the logging. And they were often men who had logged from when they were very young, like 12, 13, and they just really had not done anything else in their life. And many of them didn't have that much education. And so we worked with them and we decided to do this chainsaw buyback program where they would invest in a new business, which would be their chainsaw, which we would buy from them. And then we would also invest in their business, like angel investing, which is to say, if the business failed, we lose the money. They don't end up horribly in debt and can't get out of it. And then we asked that both the husband and the wife start a business. So they're more likely to be successful. And we've actually only had one family go back to logging. It's been wildly successful. So
you sort of, in a sense, have touched on intra-household partnerships and dynamics, yes, including gender issues, right? So,
and the women tended to be better educated. So it was also important that we involve them.
And engage, yeah.
Yeah.
Coming back to the providers, because you talked about healthcare being such a driver of so much of the logging that people have had to do, and we'll touch also on the bigger structural issues around that also drives logging, but certainly the need for healthcare, and same thing in the United States, as highly resourced as we are, that one of the a major cause of bankruptcy is often healthcare needs, right?
Yes, that's right.
It's a universal issue. But coming to it seemed like in many communities, the call was for the healthcare delivery. And so establishing clinics or working with the government around healthcare, system integration and bringing in providers. Talk a little bit about that process and how the clinical team kind of also came to incorporate these planetary health principles in their own clinical care delivery, because I think that's a challenge for all of us as clinicians. How do we integrate this when we're sort of in an exam room or in a hospital system? But I think many of the Health and Harmony clinicians really do kind of, it's a foundational integration. How have they come to that? And can you speak to that?
Well, for us in all of our sites too, it's I would say it's an enormous draw. The providers get it often, right? They are people who are like, boy, if we do not deal with climate change, if we do not deal with healthy ecosystems, we're just not going to make it, right? So they come often with that understanding, but then we do a huge amount of education, right? And then they are learning from their patients and their patients are learning from them. And it's part of how it's just discussed in every encounter. And we think about it in this way, like, how is this, how is malaria? This person has malaria. Well, how is that related to the fact that there's logging, right? And so that's education in the communities, but it's also education in the exam room. And then it's discussed when you're paying with seedlings, right? This is going to help reduce the risk of malaria in the communities if we reforest, right? So it all comes together in this kind of bigger picture, because that is the bigger picture, right? And it's true in the United States too. You see someone with asthma and you're not thinking about air pollution, and you're not thinking about where exactly they're living. Are they living right next to a big highway, right? These are factors that you're missing out if you're not thinking about that.
Yeah, you bring up a good point, and very, very poignant. The first person to have been probably listed as cause of death, being all the Anthropocene changes we're making, was a young asthmatic girl in London who lived near a highway, and it was the particulate exposure. So it's there, but sort of actualizing it as we deliver our clinical care in a holistic way, I think is a wonderful opportunity, and certainly that's being lived out in all the clinics with which the organization is working. I did want to just touch on sort of this idea of
and come volunteer and learn how to do it.
Well, there you go. Well, speak a little bit about those, exchanges, maybe about how that looks, and because there is this broader conversation around decolonizing global health, and white saviorism, and the high income country team coming in acting like they have solutions that are not even germane, and the expertise is on the ground. So there have been a lot of mistakes around that in the past. And how does that kind of play out as you think about, nonprofits working together, and from high income
Yeah.
country setting members and lower income country setting?
Yeah, so we're very careful about this. And for us, it's always about under the direction and control of local communities and our local staff, right? So we would never bring in outsiders if it wasn't actually requested by the staff. But they want it. And they want it because they want to be able to learn and teach. There's 100% and teach, right? I'll give you, this is an example from one of the community members. He said, we are the pathfinders for where the world needs to go in how to live in balance with the earth. And now we want to teach the world, right? So they get it. They want to teach the world. And we have designed a system, and we do a lot of education of those coming in. You are here to learn. And there may be things that you can share, but that's going to be under the direction and control of the communities. But our docs really like it because they like the opportunity to be able to learn from different medical systems from all over the world, because we have people come from all over the world. And our nurses are always frustrated because they don't get nearly as many nurse volunteers as the doctors get volunteers. And they feel that's unfair. So please, any nurses out there who would like to come and visit, please come. So. And now that COVID is calm, for a few years it was on break. But
glad you worked that in. That was good. But yeah, certainly addressing those really living the principles of equity, both in sort of the work itself as well as even the nonprofit management, and so that the model is that Health and Harmony works with a local NGO or NGOs in every
correct
setting, right?
That's right.
And in moving beyond
funneling resources, we kind of think about it as like the trunk and the roots of the tree, funneling resources in an anti-colonial manner back to these communities, because if we don't, we're not going to survive. But it has to be under the direction and control of the branches, right? They decide what they need and want and how they want it. And then resources are funneled to them.
And maybe you can touch a little bit on the notion of the connecting potential donors or thank you folk with the people doing the work and needing the resources, that concept of that app to bring people, just to be a virtual place to bring people together for that exact exchange that you outlined, that's driven by the local needs. You want to talk about that?
Yeah, so basically when we look at the problem of climate change, it's terrifying. It's so scary. It's just like, I'm so heartbroken by Ukraine right now. And I also see it within this context of the whole earth being so unstable and so on the edge, right? And we have less than 10 years to figure this out. And if we lose our rainforests, it is game over. Why does Health and Harmony focus on rainforests? Because they are the key linchpin. If we absolutely stopped all fossil fuel emissions tomorrow, and we continued deforestation at the rate that it's going, it would still be game over for the planet. And the thing about rainforests is that they are at this tipping point, because they create rain that feeds the trees. It feeds the trees locally, but it also does amazing rivers of in the air, in the atmosphere, that create rain half a planet away. And so in California, where I live, where we've had horrible fires, a lot of the drought is actually because of loss of forest in the Amazon, and even loss of forest in the Congo Basin, and even in Indonesia. It affects rain all over the world. And so if we lose these forests and they go over this tipping point towards a savanna where they're not producing enough rain to feed themselves, the amount of carbon that would be released is just astronomical, right? And we're also talking about half the world's biodiversity. So the other thing about forests, though, is that standing, they draw down carbon from the atmosphere. In fact, a third of the pollution that humans emit every year is sucked down by forests. So if we can reverse the loss of rainforests, i.e. stop what's being lost now and bring back a whole bunch more, which we saw at our first site, 52,000 acres more of forest grew back, right? It is possible to do this, and quickly. And we need to do it quickly. And the solution to do it is to listen to rainforest communities. But there's no way that we can do that fast enough all over the planet as one organization. There's just no way. And my experience is that many Global South-led, BIPOC-led organizations are doing a great job, but have a very hard time getting resources. Many of the bigger NGOs, the big conservation organizations, are very good at fundraising. Not so good at the work underground. Right? Their capacity to truly listen to communities and implement those solutions is marginal. So our idea is how can you funnel resources directly from individuals from the global north who get it that if we don't save our forests and we don't address the colonial crisis of justice at the same time, that we are not going to make it as a human species. And so our idea is to funnel resources directly to rainforest communities or to Global South-led small NGOs that can help support those communities to reverse the loss of forest. And so we're trying to do that with technology and do it fast. And it's going to be called the Rainforest Exchange. And you can sign up to get the beta release if you want at rainforestexchange.org and help us design this. And then we also want to, in the same app, we'll be calling folks from the global north to also be having radical listening meetings. And we'll be facilitating that and helping us figure out, how are we going to also contribute to a thriving planet.
Yeah, no, I'm glad you make that point because, in some ways, talking about the individual pressures that lead to logging, there's also these structural incentives that lead to logging, which is, eating a lot of red meat, right? And turning forest into pasture land to service. So for all of us to choose more of a plant-based diet, can really help actually as well. There are things we can all do, in this space, including supporting the indigenous wisdom and interventions on the ground. And so it's nice to hear about that app. One of the other things I think you talked about or thinking about with that is also being able to track the impact, because I think one of the things that Health and Harmony has done well is to build in evaluation to be able to say what have we been able to accomplish, to make course corrections and just to see if things are going the way they should be. So can you speak a little bit about that evaluation approach?
Yeah, so all that data that I gave you about the amazing impact we had at our first site, that was done by Stanford. It took 2 years of analysis. It was incredibly hard work on all of the team's parts to get all that data to them and help support them. And that just can't be, right? Because it means that only wealthy organizations from the global north who have lots of connections are really able to get those kinds of analyses done. And so we've been partnering with Woodwell, which is used to be called Woods Hole, and it's now Woodwell Climate Institute, with some of the best climate scientists in the world who look at satellite data and who can measure carbon like on a pixel basis, on a 30 meter by 30 meter basis, how much carbon is in that with AI. And then to have that freely available for everyone all over the world to be able to see what the impact is. And to be able to show these communities are protecting as much carbon as 14 years of carbon emissions from San Francisco, right? 30 million flights across the US, things like that, right? Whoa, okay, I get it, right? This is really big impact. So that's what and we're trying to make that available for everyone. And that will be available on the app. And so any partner organization, including communities, will be able to show what the impact is. And then the other thing we're also working on is Indigenous evaluation, so that communities are evaluating their own well-being. And we're partnered with Nicole Redvers, who's this amazing Indigenous PhD. She has a lab where she has a lot of different students, Indigenous students who study Indigenous evaluation around the world. And one of her students is going to work with us as well and coming with us to Brazil, to our site in Brazil, and help us work on that. So Lynn Mad Plume is her name. That just feels like also a wonderful part of the work.
That's great. Yeah. You've laid it out for us, Kinari, the very stark terms of what we're all facing. And frankly, the planet will be fine, but the human species and all the other species on it, aren't right now. That's the looming problem. And sometimes it is hard to not feel a sense of despair or to get frozen. And so how do we maintain our sense of hope and action forward in this work? What works for you? What do you see working with your colleagues that you work with around the world, including in the Indigenous communities that have suffered the most from all of this? How do they maintain a sense of hope?
Yeah, that is actually why I wrote this book, and the subtitle is A Journey of Hope Through Healing the Planet. And the reason that I wrote this book is because I actually began to find hope after I saw the impact that these communities could have so quickly. And when that happened, it was actually like this sort of seismic shift for me. Because even though I had been doing this work for many years, I was doing it without hope. I figured if we were saving forests in any way, it was only for a post-human world. And when I began to realize, oh, we could actually turn this around, then I realized I had to work on a global level. And for me, it's just an example of when you actually have hope, how you can begin to think, oh, what could I actually do in that case, right? And is there some role that I could play in this great shift that has to happen on our planet? And it is a shift towards thriving, right? It is a shift towards justice. It is a shift towards not only humans thriving, but biodiversity thriving. It's not loss, right? I think one of the problems is that people often think, oh, climate change, I have to suffer, I have to lose. But it is not about loss, it is about gain. And I really believe that if we can find that hope, and it's why I share these stories from these communities, that's part of the healing that has to happen. The personal, community, and global healing. Yeah.
I'll just close this part with asking the one last question. Then we have a list of questions that have come in already that have sort of grouped thematically, and then we have some more coming in on the Q&A. So thank you, audience, for that. But just as a note, since we're speaking today, sort of co-hosting this out of Yale University. Yale students want to make change in the world. They want to help improve the world. You're an exemplar of that. How are ways that even to be a little bit narrow that Yale community members might be able to get involved?
So we were working with a Jedi specialist, amazing woman, and she said, I was talking about, really, should I step aside? Should I be involved in any way in this, right? And she said, do you think that there can be an anti-colonial flow of resources to folks from the global South without white people? She said, do you think that we can heal the wounds of our earth if those who have a lot of the resources are not involved? And I was like, oh, okay, this is a good point. So and it's also incredibly important that those with a long history of privilege are not making the decisions, that the flow of resources is under the direction and control of those who have historically had their voice and their agency taken. Because communities who know what the solutions are, those who are closest to a problem know exactly what the solutions are. So what can folks from, whether people of color or people from historically privileged backgrounds, what can they do? They can listen, first of all. They can follow. They can channel resources. They can and resources is not just money, it's knowledge, it's expertise, but under the direction and control of those who are closest to a problem.
Thank you.
Yeah.
So we'll turn to some of the questions that did come in because we want to make sure that we can surface those. And looking through them, there were a couple of thematic areas. So one was around the radical listening technique and approach. So I'll just give you a couple of those. Can you describe an event that shows why listening to local people is superior to bringing in ready-made Western solutions, which are often ill-fitted? I think you've given us some examples of that. But in the course of doing this work together, what have you encountered as the biggest challenge in listening to communities?
Yeah, so I will give one more example about that, though, from Brazil. So we're just starting to work. We've been working for a while now, for a year and a half now, with communities. They're descendants of rubber tappers in the Amazon, who are amazingly good protectors of the forest. But now we're starting to work with indigenous communities as well. And both communities, but more so the indigenous communities, one of the designs that they made was that they wanted to mix indigenous and Western medicine. They recognized that there were things that indigenous medicine was much better at and things that Western medicine was better at. Like they wanted access to tuberculosis medicines, right? Which is a disease that actually came in with colonialism, right? But they also wanted all of their indigenous knowledge to really be honored. And they didn't necessarily want to share it, right? So they are designing these very specific ways that that this traditional knowledge can really be honored, and that the children can be involved in that, and so that they also, that a crisis of mental health among the children as their worldviews are being, sort of coming into conflict, I would say, with a colonial settler view. That's really that it's their knowledge is very much honored. That's just an example. Can we repeat the second part of the question?
Challenges that have come up in the course
of. Well, okay, so I'll give an example. I did some radical listening in Bali, and one of the community leaders, he said, no, I refuse to have radical listening done in this community because I know what the solution is. And I don't want to hear it if they don't agree with me. And I'm going to keep working on that thing. And and I was like, well, it could be useful to you just to know whether or not the community agrees with you. And if they don't, that's fine. You can still work on it. But if if they do, that could be useful. So finally, it's like, fine. So we held this radical listening meeting, and the community was just like, this is the problem, and we have to address it in this way. And it was exactly the problem that he had identified. And it was actually it was about about the way the irrigation system was done, and that they didn't actually have enough water, and that this then led to the death of some trees that they had been planting, and they couldn't get enough rice, and they were like communities were fighting with each other to get access to the water, and it was a big conflict. And he at the end said he was so grateful, because now he knew every single household in the community was 100% behind him. And then they quickly came up with the money to fix the problem. And I was able to get them a water engineer like that day who could help them. So this is like I just think that it's one of these things where when a community if there's like internal power, when a community realizes they're all on the same page and that they all want to go after these solutions. So
yeah, and the radical listening is a way to get that out there. And
that's right.
so a related question about how health and social entrepreneurs can incorporate this technique when they may have constraints on their own time and resources as well. And I see we did put in chat that you've made some teaching about radical listening available on that website if people are interested in learning more, right? Yeah.
Yes. So come to radicallistening.org. We have webinars every month. And I know we often cite this number that we spent 400 hours in our first year. And you may think, oh my God, well, I could never do that, right? But actually, we've discovered it doesn't take that long at all, right? We only did that many hours because I thought every single community was going to come to a different solution. And in fact, in many of our other sites, it can just take like a few days to do meetings in every community. It doesn't take that long at all. It's like an hour and a half in each community, done. But the thing I would say about it is it actually saves you an enormous amount of time because you're going to be doing the thing that the community wants. They're going to be 100% behind it. And you're not going to be spending a huge amount of time convincing people to do something that isn't the right thing to do. So, yes. And then they won't do it. So it actually saves a huge amount of time.
Partnerships is another theme I think that came up in some of the questions that came in. So one question was about how you're engaged with international NGOs. You've talked about local and country level NGOs. A related question also is, what do you see about some of the biggest challenges for the current Health and Harmony site partnerships? And then I think there was another question around what might be possible to make this model of working, completely with community-driven solutions go a little more viral. So think about those questions in terms of partnerships.
Yeah. So I was recently talking to another organization that thinks a lot about scale. And one of the things they said was, who are the doers at scale? It's got to be communities, right? So the challenge is that not all communities are well enough organized and have bank accounts and have, systems of dealing with the safety of money and making sure that it's going where it's supposed to go, et cetera. So, but that challenge were solved. The ideal thing would be for money to go directly to communities and then communities to outsource if they wanted to, right? Okay, so we need help with healthcare. We are going to ask this organization to come in and help us. And we'll pay them to do it. Right. And ranking, this is a 5-star, provider of this solution. And this one's a 2-star, right? We don't want to go with that one. Right. So that the power and control would actually be in the hands of the community. That's in my perfect world. That's actually how things would be done.
Kind of another thematic area was around just the linking of climate and healthcare, and so what and we've talked about the planetary health framing, but what was your greatest challenge in linking healthcare and climate care is one question. Another one is what's the main action that healthcare providers and healthcare systems could do to help the environmental issues. And then just thinking about how much of the climate crisis, is impacting the health crisis. So broadly speaking.
I feel like one of the biggest challenges for us in linking healthcare and the climate crisis is actually this problem of how polluting the healthcare industry is, right? I was recently in the hospital in the US when my son was born a year ago. And I just couldn't believe the number of all these cords and plastics and they're just huge containers of plastic every day. And we, in Indonesia and in Madagascar and in Brazil, we try very hard to have less waste, but there's a lot that's very hard to avoid. And I feel like we really need some good technology in how to create less wasteful healthcare, right? It's an enormous part of the emissions, healthcare access in this country. We don't really think about that, but we are destroying, when you think about Do No Harm, right? There's a great organization actually called Do No Harm, but that is about trying to reduce the waste and the pollution and the toxic exposures within the healthcare system. I would say that for us in a strange way is the biggest challenge. Otherwise it's quite obvious in the communities, right? They fully see healthcare and environmental well-being as all fully intertwined. There's no challenge there.
Yeah, no, you make the point about the healthcare sector itself and the way it does damage in the way we carry things out. 8% of greenhouse gas emissions in the U.S., 5% at least globally, are just from the health sector. So there are better ways to do it. And when we have colleagues here at Yale, like Dr. Jody Sherman, who has a center on climate and health, trying to work on that with healthcare systems. But foundationally, obviously, one of the biggest approaches to reducing healthcare related pollution and waste is prevent the disease in the first place, right? So coming back to the primacy of prevention so that people are healthier and even need less interaction with healthcare delivery. So always
amen.
Foundational principles, right? Yeah.
And did you see all this fascinating stuff that's been coming out, this research that with the decline in air pollution during the pandemic, there were huge declines in like heart attacks and I don't even think we realize how much toxic environments in which we live affect our health. And that if we cleaned it up, things could go a lot better. Thriving.
There's that sense of hopefulness and the thriving, right?
Yeah.
Yeah. Thinking, yeah, I guess coming to some of the questions that were put in here as well during the session. So, in the course of doing the work around radical listening, what happens if, there's a problematic, someone's dominated it, or there's a power dynamic where, have you encountered situations where, when there isn't a climate that supports open communication, or where, people may disagree and there isn't a beautiful consensus that happens immediately, how does that go?
Well, we hold the meetings until an agreement is come to. It usually happens after about an hour and a half. I've occasionally had longer meetings than that. It is not a process of facilitation. So it is not jumping in and telling someone to shut up. In the beginning, I kind of felt like I ought to, especially if the leader was speaking too much. But I realized that after time, actually, the leader is the leader for a reason, because they are respected by the community and they actually have often very good ideas. But my experience is that if you just silent and you just keep waiting, people will start facilitating themselves and they'll call out someone that, you know what, that's not really what we're addressing here. What we're trying to figure out is what's the right solution for the whole community. And then sometimes for sure, like in lulls, when sometimes you can tell usually when there's sort of a group that has not said as much, or women sometimes won't say as much, and then not specifically calling out people, but just kind of asking kind of more generally, do the women here agree with this? Or, women are experts in things men are not experts in. What does your expertise tell you? Or, what do the people over here think? And my experience is that when there is a holdout or there are groups of people who don't agree, when the rest of the group really begins to grapple with that concern, and then often they kind of shift their solution a little bit, and then this moment where everyone's like, yes, okay, if that happened, then it would work, right? So, and it's not like 100% consensus, but there's usually these moments where it's like everyone, those who maybe agree less don't disagree so much that they're not willing to go with the solution of the community. Yeah.
So one of the questions that was upvoted by several others as well is around this, wonderful to see this model of local decision making, local control and solutions. But realistically, there's also these global forces at work that, as we've discussed, that have historically impacted local people's health and well-being and continue to, right?
Yeah.
And so
Yes.
how do we balance that need to have locally driven solutions, but still at the same time recognize that there's multinationals and there's
Right.
corporations and there's
Right.
economic incentives, and us as global consumers are contributing directly. How do we deal with that macro level as well as the local?
Yeah. So I'm so grateful there are organizations who work on that level, and I want them to continue to work on that level. Yes, please. This is super important, and we're going to have to come at this problem from multiple directions. And what I see is that there's very little work in this other side, right? There's very little work on the community agency side. And it interplays with each other. I'll give you an example. There's some work in central Kalimantan that I did. I would listen along a river. On one side of the river, palm oil had already come in. On the other side, it was community land, and another palm oil company was trying to buy the land from them. And they didn't exactly have ownership of it, but they were still going to need to be paid off because this was also obviously historically their land. And their perspective was, we don't know what to do. Like we're just doing so poorly, especially now that there's palm oil on the other side of the river, that we feel in a difficult, we just don't know what to do. So I said, what would you need as a thank you from the world community? They said, if we had training of our healthcare providers, and the healthcare providers were often in the room saying, yeah, we don't really know what we're doing. It's hard for us to know when someone's sick enough that they really need to go to the hospital, right? Like we need training. Fish farming training, because they had less fish now in the river because of the runoff from the palm oil, and water filters. They said, we would be independent and we wouldn't need to sell our land to the palm oil companies and become slaves to them. Then we would resist them fully. Right. So there's an interaction on both sides.
Yeah. Thank you for that example.
Yeah.
It's been fascinating. We're so grateful for you sharing your time with us, especially on a birthday that could be celebrated today. And so I just want to take a moment to say thank you, and thank you to all the colleagues at ASFRI and everywhere around the world where Health and Harmony has the honor of being able to work. I'd like to thank the Health and Harmony team: Connie Gersuk, Devika Aggie, Trina Noonan, and Devin Schmidt. And then thank you to Yale Conference and Events, Jennifer Zachariah, Brianna and Chellam, and our own Yale School of Nursing, Office of Global Affairs and Planetary Health, which is the name of our office, thanking Sohani and Marianne and Dr. LaRon Nelson. So thank you everyone also who's attended today. The session has been recorded and will be able to be made available. And you've got some of the references and resources also in the chat should you wish to continue to explore this area and this space. And we hope on behalf of the planet and people everywhere that more of us do. So thank you, everyone.